I'm Madeline Jacobs. I'm a family physician who is now retired, who had my practice in rural Colorado for 28 years. This group, Healthcare for All, was a break-off group from the local Indivisible group. And then the Colorado Foundation for Universal Healthcare asked me to be a community organizer for Custer, Fremont, and Chaffee counties, and I said yes. So that's basically how this group got started. And we simply started with a meeting of people who had heard about it. It was just a small group, 4 or so people, and that's how we got started. The wonderful thing about the Colorado Foundation for Universal Healthcare is that they're a wonderful resource that are very supportive of their grassroots groups.
Hi, I'm Judy Van Acker, and I am a retired librarian. I've lived in Fremont County for about 30. Healthcare for All in general means that everybody has access to healthcare. We stand on street corners. We've been in parades. We write letters to the editor. Which, by the way, every single newspaper that we've written a letter to, they have published. We've just tried to reach out to as many groups as we can think of. And the interesting part about that is that a lot of the groups that we've reached out to, the churches, the Rotary Club, co-ops, just a number of groups have been very positive. Yeah, come on in, talk to us about this. We've done some cold calling, which is a little uncomfortable at times, but we've, for the most part, been very successful with that. Put one foot in front of the other. I think you just need to say, we can do this, because our small group started as a small group and we grew a little bit, and we continue to just say, what do we do next? One venue that we were booked at was a radio station actually in Salida, and they invited us up there to speak. And that's just a wonderful way to get your message out to a lot of ears, right? Some people are visual, some are audio. And so we went up there and did, Dr. Maddie Jacobs and I went up there and did a wonderful segment on universal healthcare. So it's just another place where you can go to get your message out. And once you get your message out that way, then you never know what other doors will open up. So yeah, just keeping it visible. Keep the message out there. Keeping it in front of people.
My name is George Dimiterico. I'm a retiree, and I've been involved with the universal healthcare issue for about a year. One of the things that changed for me and proved to be very helpful to me personally, based on my reading of George Lakoff's books, is that I'm here involved with universal healthcare in order to carry my message, not to engage in a debate. One of the things that early on I found kind of concerning was, well, how do you come up with the perfect words to prove the other side wrong? I no longer think about that at all. What I'm here to do is to talk about what my beliefs are, what my values are, and that is very simple. Universal health care is a right for everybody, and my society will be better off when everybody has universal health care. That relieves me of the pressure of worrying about how do I win a fight. I'm no longer fighting.
I was a rural physician for 28 years, and I basically retired a little over a year ago for several reasons. One of the primary ones being that I was unable to provide care for my patients. I had 3 asthmatics end up on ventilators in the ICU because they couldn't afford their medication, and I hadn't had an asthmatic in the hospital, let alone the ICU, for a couple of decades. I had 3 people between the ages of 50 and 65 die from colon cancer because they couldn't afford colonoscopies. So people are literally dying, and our healthcare system is in crisis. The thing that inspires me to keep going is, first of all, the incredible support that I get from my fellow group members who have shown incredible dedication. Our goal is to get the message out for universal health care every interaction of every day, And we decided that we could handle one action per week. And in fact, we have had sometimes up to 3 things that we're doing per week. And that includes all sorts of actions, even if it's just a 1-hour demonstration on a busy corner, to doing PowerPoints for various groups, to writing letters to the editor, to working on legislative issues, to being candidate liaisons. There's a lot of stuff to be done. Universal health care, in the way that I use it, is that human care is not only a human right, it's a human necessity. We live in human bodies that will get sick, will age, and will eventually die. And everybody needs health care simply because of who we are. When people recognize that we are in a healthcare crisis, there's a lot of passion behind that and tapping into that. We don't have to be inventing the wheel here. 57 other countries that are democracies in free market countries have already figured this out, and it's really simply a matter of choosing what we want to use. And in fact, that's what Taiwan did. And we have 2 bills now in Congress that are improved Medicare for all. Senator Sanders' bill in the Senate actually has a 4-year transition. In fact, Taiwan implemented this overnight. It is not so traumatic, and it just makes sense. And as has been shown around the world, we can make the moral decision to take care of Americans.